Hello and good afternoon. I am Dr. Shreya and I'll be your examiner today. Can I know your name and age? I'll be performing the breast examination on you. Do I have your consent? I'll be doing it in 3 steps: general inspection, palpation and general inspection of your lymph nodes. Is that okay with you? You can change your clothes in the private room. You have to undress yourself up to the waist. Thank you. For general inspection, I asked my patient to sit upright with her hands relaxed and kept on her thigh. Then I asked my patient to uncover her breasts, and then I noted for any deformity, scars, swelling, nipple discharge or asymmetry. Now for the second step, I'll ask my patient to put her hands on the hip and push inwards so we can tense the pectoralis muscle. If a mass is noted and moves with the pectoralis muscle, then it suggests a malignancy. This is called death ray. Now, for the third step, I'll ask my patient to raise her hands, or I'll ask my patient to keep both her hands behind her head and note for any deformity, scars, swelling, nipple changes or skin changes. And then finally, I'll ask my patient to keep her hands behind her head and lean forward, and then repeat the general inspection. I ensure that my hands are warm before I touch my patient. I'll check the normal asymptomatic breast first. I'll ask my patient to lie flat on the bed with her hands behind her head. And now I'll squeeze the nipple gently. If discharge is present, I'll note the color, odor, consistency and amount of discharge. For palpation of the breast tissue, I'll use the spiral method. I'll use the finger pad of my 3 fingers, pushing downward on the chest wall in circular motion to note for any masses. If a mass is noted, I'll describe it using position, size and shape, consistency, mobility, fluctuance and overlying skin changes. Also, I'll palpate it to 3 levels: superficial, medium and deep to the chest wall. Now, I'll palpate the axilla with my free hand, the medial, lateral, posterior and anterior walls of the axilla and also the apex of the axilla. Now, for the general inspection of the lymph nodes, I'll check the cervical, the supraclavicular, the infraclavicular and the parasternal lymph nodes. Now, you can go and change in the dressing room. Thank you. We are done with the examination. All your findings have been normal. Thank you for visiting.